Nusa Tenggara Timur Malaria Report 2020. Eliminating malaria has been a challenging effort for years. 5 million population is spread across one city and 21 districts in Nusa Tenggara Timur. Kota Kupang and 5 districts belong to Timor Island. It has 2 land borders with Democratic Republic of Timor-Leste. And then 4 districts in Sumba Island, 8 districts in Flores Island, while Lembata, Alor, Rote, and Sabu has 1 district for each island. Nusa Tenggara Timur had 531 listed health facilities in 2020, which provide malaria examination services. They are hospitals, clinics, and puskesmas. Puskesmas is the only facility to facilitate prevention activities, including active case detection, such as mass blood survey or MBS, house visit, and epidemiological investigation. These activities are carried out among the average density of 111 people per square kilometer in Nusa Tenggara Timur. Malaria data is collected through an online application called Sistem Informasi Surveillance Malaria or SISMAL. Every puskesmas and other health facilities which provide malaria examination must report the malaria updates each month in SISMAL. In 2020, 96% of health facilities submit their full report. Internet connection is still a challenge in remote area, but combination of offline and online report in SISMAL is effective to tackle the situation. Based on the maximum and minimum patterns of malaria cases each month since 2018, the number of malaria cases were highest in wet season, January, February, and March. Malaria endemicity. In 2016, there were 7 districts with high malaria endemicity level, 9 districts with moderate level, and 6 districts with low endemicity level. In 2019, 4 districts were in moderate endemicity level, 3 districts in Sumba Island in high endemicity level, while other districts and cities in low malaria endemicity level. In 2020, 3 areas had zero local transmission for 3 years in a row: Kota Kupang, Manggarai, and Manggarai Timur. An elimination certificate was given to each elimination area by the Indonesian Ministry of Health on April 27, 2021. While other districts have been categorized as low endemicity, Alor remains yellow, which means the number of malaria cases is stagnant since 2016. On the other hand, Sumba Tengah has reached moderate endemicity level. 3 districts in Sumba remain red due to its cases still being highest among all islands in Nusa Tenggara Timur. In terms of the overall endemicity level, 60% of the population in Nusa Tenggara Timur is located in low endemicity areas. 19% live in elimination areas, including Kota Kupang as the densest region in the province. 15% are in high endemicity areas and 5% in moderate endemicity areas. Here we can also see the malaria endemicity level from 2010 to 2020 by each district and city. In this period, annual parasite incidence has been fluctuating in order to reach malaria-free state. Every district has its own unique criteria. The socio-cultural environment is different in each region. The house architecture, the way people deal with sickness, and also various traditional medicine they use. Trend in reported malaria cases since 2006 to 2020. Malaria cases significantly dropped from 2010 to 2015, and then it was fluctuative between 2015 and 2020. In 2020, Sumba Barat Daya experienced 8,496 cases, followed by Sumba Barat, 4,391 cases, and Sumba Timur, 1,639 cases. Therefore, Sumba contributes 96% of malaria cases in Nusa Tenggara Timur in 2020. Malaria can cause severe illness and death when we ignore the prevention and standard medication. There were 2 deaths from malaria in Nusa Tenggara Timur in 2020. One was from Sumba Timur and another one from Kupang District. Malaria by age. There was 44% of malaria cases in people between 15 to 64 years old, 22% in 10 to 14 years old people, 19% from 5 to 9 years old, 13% for children under 5, 2% for people above 64 years old, and 1% in infants. Meanwhile, 1% of malaria cases are found among pregnant women in Nusa Tenggara Timur. Malaria in pregnant women is a serious public health issue. It can lead to anemia, premature birth, low birth weight, and even death of the mother and child. Long-term risk of malaria in pregnant women includes growth problems, cognitive impairments, and stunting. The integrated activity of controlling malaria with health services for pregnant women and children under 5 aims to protect pregnant women and children from malaria transmission. Screening for malaria and providing mosquito nets for pregnant women is carried out during the first prenatal visit, and screening for sick children in health facilities, including Pustu and Polindes. 71,530 pregnant women and 12,306 children under 5 were screened for malaria in 2020. Timur Tengah Selatan has the highest number of screenings among mother and child. Malaria cases among pregnant women in high malaria endemicity level areas was 93%, but the screening for malaria remains low, only 4%. We need to increase the coverage of screening among pregnant women, especially in high malaria endemicity level areas, to prevent complication and even mortality. One of the strategies of vector control in malaria is to use the mosquito nets or long-lasting insecticidal nets, which will protect us from mosquito bites while sleeping for at least 3 years for each new net. In Nusa Tenggara Timur, there were 973,800 sheets of long-lasting insecticidal nets distributed in 2020. The allocation was categorized based on the endemicity level or events. Nets for high endemicity areas, including village in moderate and low endemicity level. Nets focused for moderate endemicity areas. There were also nets to respond epidemiological investigation, nets for disaster, outbreak, and for pregnant women in integrated routine activity. Every malaria case is followed by 1 to 5 epidemiological investigation method for the case itself and also the focus area. This process will help us to understand the origins of malaria transmission in an area, whether it is an indigenous case or imported case. Epidemiological investigation is very important for vector control. There were 746 malaria cases with epidemiological investigation out of 15,341 malaria cases in Nusa Tenggara Timur in 2020. 7 districts as well as Kota Kupang have reached 100% epidemiological investigation for their malaria cases. Note that Ngada had no malaria case in 2020. 82% of malaria cases from epidemiological investigation were indigenous, and 18% were imported cases. Mostly imported cases were from Papua. In 2020, there were 3 types of malaria parasite that caused malaria infection in Nusa Tenggara Timur. They are Plasmodium falciparum, which is the main parasite in the region causing malaria in 68% of cases, and then Plasmodium vivax, which causes 26% of cases, and Plasmodium malaria, which is responsible for 1% of cases. In addition to those, mixed parasite Falciparum and vivax is linked to 5% of malaria infections. If we relate the malaria parasites to the different endemicity levels, then we will find that in high endemicity level areas, there were 68% rate of Plasmodium falciparum, 26% of Plasmodium vivax, 5% mixed Plasmodium, and 1% Plasmodium malaria. This mix is quite similar to low endemicity level areas. Meanwhile, for moderate endemicity level, Plasmodium vivax is almost as much as Plasmodium falciparum. Here is laboratory confirmation of malaria suspects since 2010 to 2020. In 2020, there were 398,000 suspects were confirmed by microscope and rapid diagnostic test or RDT. Here is the trend of standard medication for malaria patients in 2010 to 2020. The percentage of malaria cases which get standard medication in 2020 was 92%. Artemisinin in combination therapy or ACT is considered as the most effective anti-malarial medication in Indonesia to combat malaria parasite. ACT is given after laboratory confirmation. 14,042 patients received ACT. Lembata, Sumba Barat, and Kupang District need to increase their coverage on standard medication, while Ngada remains zero because they had no malaria cases in 2020. A high number of detection cases are important in cutting malaria transmission. The indicator is the positivity rate, with the number of positive cases from all types of malaria case detection activities divided by all laboratory examination, microscope, and iridity from all types of malaria case detection activities. In 2020, the positivity rate for Nusa Tenggara Timur was 4%, while national standard in Indonesia for positivity rate is below 5%. There were 3 districts which did not reach the positivity rate standard: Sumba Barat Daya 23%, Sumba Barat 19%, and Sumba Timur 5%. Reducing the positivity rate is possible if we increase the coverage of active case detection, such as contact tracing, house visits, mass blood survey, and migration surveillance. Nusa Tenggara Timur had reached 62% of passive case detection and 38% of active case detection. Total case detection in elimination and moderate anemicity area reached the target in 2020, while in low and high anemicity area did not reach the target due to COVID-19 pandemic. Malaria mostly detected by microscope. It was 86% and 14% by RDT. Beside the positivity rate, the effort of malaria case detection is measured by annual blood examination rate or ABER. This is the proportion of cases detected compared to the population at risk. The ABER standard is different for each district and city, but basically is according to the anemicity level. ABER coverage will be more accurate when we can map receptivity and focus area in all districts and cities. Mapping receptivity area is the main activity in low malaria anemicity and elimination areas. A village is called a receptive area when we find Anopheles larvae in the potential breeding places. Ngada had the highest coverage of identified receptive area, while Flores Timur, Belu, Saburejua, Sumba Tengah, and Sumba Barat had zero coverage in 2020. This is the end of Malaria Report 2020 from Nusa Tenggara Timur. Terima kasih.